welcome to nursing webinar session. Myself Shanti, and we are going to discuss about the topic on fundamental care of a newborn. For this, I welcome Dr. M. Abhitej Reddy Garu, who is our consultant neonatologist from Yashoda Hospitals, Secunderabad. I welcome you, sir.
Good afternoon, everyone.
And we are very privileged to have you with us today.
Thank you so much.
Yes. And let me also welcome our senior nurse, who is Miss Jyothi, who is from Neonatal Intensive Care Unit. I welcome you, Jyothi.
Thank you, ma'am.
Yes, and you would like to quote a few, sentence on this topic?
Yes, ma'am. Hi, everyone. Newborn care essential is very important. All pediatric nurses must provide high quality of nursing care to the newborns.
So going forward, we will have a lot of discussion. I think I'm going to just take the back seat because I should see Jyothi and you, giving the acknowledgement to and from.
Yes.
So, sir, the first insight we would like to have from you is newborn care is crucial for a healthy, outcome and as well as parents' satisfaction.
Yes, the newborn care is very crucial and essential in the start, as it is a beginning of a new life actually. So
Yes.
it is great transition for a newborn baby actually. So the baby has to adapt to the outside life and it has to start breathing on its own and start to feed the baby. So it is an important step and there are a lot of challenges at each and every step. Actually, it is very important as we have to monitor at every level and we have to assess at every level and we have to involve parents also and we have to teach them how to care the baby at the home and during the first 1 month of life or in the few months of life. Okay.
Yes.
So
not many challenges also we will discuss. Over to you, Jyothi, for the rest of the session. Yes.
Yes, but the World Health Organization and Indian Academy of Pediatrics, newborn age is defined as the term normal newborn neonates refers to the first 0 to 28 days of life with a birth weight of 2.5 kg or more than 2.5 kg. What should be the aim of newborn care? To ensure the overall well-being of the baby, to safe transition to extrauterine life from the hospital to home, postnatal experience and parents' happiness.
So, Jyothi, because you're a NICU nurse, do you see parent satisfaction when you provide your care and then baby goes to the room side, from there baby gets a discharge? Do you see the happiness? Yes.
Yes, we to see the postnatal discharges. Parents are very happy while their baby is getting discharged.
Yes.
The parents will be, they're all very happy during when they receive their baby to their own hands and when they look at the baby center. And at the same time, we are able to teach them how to take care of the baby and we are train the mothers with our expert nurses and also for first 48 to 72 hours, we are keeping every normal newborn inside the hospital. So everybody is teaching. Yes.
I think the mother, especially the primary mother, she waits when the baby is going to come out from the ICU and then she can hold and, she can take care herself to the baby. Yes.
Yes.
So what are the tasks do you follow as you get the, information that, the newborn is going to, deliver, mother is going to deliver the newborn. So what coordinated care do you, do?
Nurses should follow and coordinate before the newborn arrivals. Communication is very important as we communicate with the gynec and OT staff and doctors. Maintain the delivery room temperature between the 26 to 28 Celsius and we should keep all the equipments ready and recheck the resuscitation kit as per the checklist that includes the laryngoscope, ambu bag, ET tubes, ET fixation and suction jars. Everything we have to keep ready and we should put on the radiant warmer with the 100% output for at least 20 minutes before the delivery.
So, sir, so these are the coordinated care. I think this is all your protocol where you train all the nurses that they should be, readily doing all this to save the, outcome of the baby.
Yes. So the communication is very important. There are standard 4 questions according to international standards of newborn resuscitation program.
Yes.
So the first 4 questions that are must to know are what is the gestation of the mother and what are the comorbidities of the mother, any high risk things are there for the mother like BP, increased BPs, increased
Yes.
sugar levels, or any fetal risk factors like babies having any less movements or fetal bradycardia, all those things. And also we have to know if there is any liquor is there or not, how is the liquor, is there any meconium strained or not, that is also important. And also at the finally we have to know how many babies we are getting, like twin babies or a singleton or any triplets. So accordingly we can adjust our resuscitation area.
Yes. So you said that the gestational age of the mother, any comorbid factors or fetal well-being and the amount of liquor.
Yes.
Yes, yeah.
Yeah. Type of liquor, like any mixed with meconium or not, that
Yes,
it
meconium
fetal
stained.
distress.
Yes, yeah.
After that, in next slide, upcoming slide, initial assessment and immediate care, it has to be done within the 30 minutes. Evaluate the newborn vital signs by checking the temperature, saturations, heart rate, and also if we have to check for the airway use the DR CPAP, that is delivery room CPAP if required. Cord care will be given along with the eye care. Record the weight, resuscitation when needed, infection prevention, and initiate the breastfeeding in OT or labor room and shift to the NICU.
So we should initiate the breastfeeding in wherever, the baby is born, after we dry and warm the baby. And the latching should start in itself by the OT premises and the labor room area or resuscitation area.
Yes. So if the baby, so immediately after newborn baby is born, we will keep the baby under the mother's stomach, mother abdomen. We'll keep
Yes.
the skin to skin contact.
Yes.
So that baby will get some warmth from the mother, and we will assess after keeping the baby on the mother's abdomen with skin to skin contact. Then we start cleaning the baby, wiping the baby, and then start we'll observe the baby like any respiratory distress is there and how is the heart rate. So after that, if baby is stable, baby is looking good, then we'll cut the cord and we'll give for the breastfeeding. So the first initially we'll try to keep the baby near to the breast so that baby only goes to the breast and tries to search for the breast and start sucking the breast. So this is called breast crawl. So that is very important in the initial period. So we have to every newborn baby like without any distress or normal care, going for normal care. So first few minutes only baby we should start the breastfeeding, so that improve the bond between mother and the baby, and mother also gets confident and will be happy.
So Apgar score, when you all do the perform Apgar assessment. So
The
this
score will
nurses,
be-
they assist you all. So should you think that nurses also should do, their own the assessment of Apgar score? Like
Yes.
this has got this. Yes, Jyothi, do you
Yes,
all
ma'am.
perform?
We to assess the Apgar score, we'll be assisting the doctors during the Apgar score assessment. First 1 minute and 5 minutes after birth, we'll assess. There are 5 parameters which will look the Apgar: the appearance, pulse, grimace, activity, and respiration. And in that, after Apgaring, we have to evaluate the Apgar score. 7 to 10 falls. If the score is 7 to 10, the baby appears normal. 4 to 6, intervention is needed. And till the Apgar score reaches to 7, if the score is 0 to 3, the baby requires immediate attention, resuscitation, and other treatment.
So, sir, your nurses are, they do this parameter and they are aware of this, or do you think that there is again, little awareness is required to perform this?
Yeah,
assessment?
actually, the Apgar score is a very simpler one and is a subject. It's an objective assessment actually. Anybody and the values are the components are very simple.
Very
So
simple.
looking at the baby only, we can just see. So how is the color? Is the periphery is blue or say every whole body is blue or whole body is pink? And what is the heart rate? So it is a
Go
simple.
back to previous slide, Jyoti.
Anybody, if the sisters are know to use stethoscope and all, they can assess the Apgar score very easily actually. And the Apgar score is important because we can see the prognosis of the baby, how the baby will prognose actually. So if baby having any depression or baby is not crying, and also they immediately alert the doctor if there is no sudden delivery was there. Doctor was nearby, but he's not available in the delivery.
Yes.
So they can alert the doctor immediately.
So it is a very easy component.
Yes.
The components are very easy and very objective to be assisted with. Yes.
Thermal care to prevent hypothermia. After receiving the baby to the resuscitation area, we will dry the baby with the pre-warm towels. After that, we will be wrapping the baby and shift the baby with the embrace bag to maintain the temperature, to maintain the thermoregulations.
Yeah. Just proceed again. Yeah.
All thermoregulation has to be continued in an ICU. All neonates should be nursed under the radiant warmer for initial hours.
So can we understand what is thermoregulation, Jyothi? How do you maintain the temperature of newborn? What do you do?
Yes,
Initial
ma'am.
wrapping,
In order
drying
to
is done. Yes.
Yeah, in order to prevent the heat loss, we will be maintaining the temperature by carrying with the embrace back to the NICU. After coming to the NICU, we'll put the baby in the radiant warmer and maintain the temperature up to 36.5, which is already setted. A baby setted temperature will be there, and the baby temperature has to be maintained according to the setted temperature, that is 36.5 Celsius.
And when do you wean from this warmer? Like when you want to hand over this baby to the mother? After 1 hour or 2 hours, or do you take off the baby from the
We'll keep
warmer?
the baby in the NICU for 2 hours till the mother shifted to the room side. Mother will be in the postnatal ward. Once the mother shifted from the postnatal to the room side, we'll be shifting the baby along with the mother.
So thermoregulation is very important to prevent heat loss, sir. So I think this is to be known to all the nurses. Yes.
Yeah. Actually, the temperature regulation is the most important. That should be started from before the birth, actually. So that's why before the delivery only we will start the warmer, and we'll keep the everything in the towels and instruments all to whichever is going to touch the baby, we should keep them in the room temperature or more. Okay, so because baby inside the home, it will be at around 36.5 to 37 degrees Celsius baby will be. So when the baby comes outside, it is if the room temperature is less than 25 and also baby may go into cold stress actually.
Cold stress,
So
yeah.
that may affect the baby health also. So the thermoregulation is very important, and there are 10 steps of thermoregulation at any time. Okay, so immediately after delivery, warm care immediately after delivery, and skin to skin contact with the mother is important, and keep moving the baby in the thermal mattress or the embrace bag, that is also important, and delaying the bath for till the temperature gets normalized after the delivery, that is also important, and breastfeeding immediately. So all these steps are important in the thermoregulation. And when the baby is normal, this baby have no other any comorbidities or any other issues, we can keep the baby along with the mother. So it is like an institutional thing to keep the baby in NICU for first 2 hours or what.
Yes.
So we can wrap the baby in the good warm towels, and we can keep the baby alongside the mother if the situation permits. So as long as whichever situation is, try to keep the baby with the mother.
Wrap and warm. Yes, and to be with the mother. Yes. Nowadays, I think a lot of good amount of and good quality flannel kinds of accessories, wrappers, mummifying the baby, all towels and all. We are good commercial ones we are getting in the market, so there should not be a problem. Yes.
Ongoing monitoring and care is also important. Once the baby is shifted to from the NICU to the room side, parental bonding and support should be there, like skin to skin contact, keeping the baby to the mother's side, so that the baby feel the touch of the mother, and checking and monitoring the vitals like heart rate and respiratory rate and temperature, and it should be documented. And head to toe care is very important, like putting the cap, metals, socks, and wrapping the baby properly, and make sure that the diapers should be checked and changed every second hourly before feed. And we also should encourage the mother to give the breastfeed second hourly.
So what about the eye care? Like, do you also, provide any amount of eye care? Do you instill any kind of eye ointment, Jyothi?
When any discharge is present, as doctor's advice, will instill the drops, eye drops.
See, that is only if there is any infection, active infection, we can see. Otherwise, if we wipe the eyes with the clean cloth and all, there is no recommendation to put direct ointments and in the clean settings and all.
Newborn red flag signs. So we have to, what are the things we need to be observed is apnea. Apnea is nothing but sometimes babies will breath hold during the sleep or stops breathing, and nasal flaring or tachypnea. The respiratory rate will be more than the 60 beats per minute, and sometimes abdominal distensions will be there. Vomitings due to intolerance feed. Intolerance feed, like we give more than the volume how much we are supposed to give, and low urine output will be there, lethargic. We have to observe all these things.
So the feeding quantity also is being told, how frequently we should give, what should be the volume of the feeding, sir?
So, any term newborn babies which are delivered at the right time and they are weighing more than 2.5 kg, who is going to be on the mother side. So, those kind of babies, we will suggest on-demand breastfeeding. So, whenever baby is hungry, baby is showing signs of feeding cues, we will give the feeding. So, how much our baby feeds. Okay, so we have to see how baby is reacting to the feed, and then accordingly we have to give. And for the babies who are sick and who are admitted in the NICU, you'll have a specific amount each day, depending on the day of life and depending on the hours of life, and how the condition of the baby, how the abdomen, how the baby's abdomen, is there any infection, is there any feed intolerance, is there. Accordingly, we'll prescribe certain amount of feed so that we will gradually increase accordingly, monitoring the baby.
On demand means when they cry, mother should feed the newborn. Yes.
Before crying also, they'll show some feeding cues. So we have to see those feeding cues and we have to teach the mother those feeding cues. Like baby is fussy and baby is like trying to searching for the nipple in the air. Baby is trying to keep the hands in the mouth. So all those feeding cues. So before crying, all these feeding cues will be there. So first we'll see them and then try to give feeding in those times.
So initial days when we see newborn always extrauterine, they keep sleeping all the time. So is it the responsibility of the mother to just wake the baby up and put the baby on the breastfeed? Because again,
See, right now, the thing is, the babies will sleep almost up to 16 to 18 hours in a day, actually. So, we have to look how the babies, whenever baby is waking up and trying to show you that baby is hungry, so give the feeding at that time. So, it can be we can wait up to 2 to 3 hours also. It's not like we have to wait every second hour, we have to wake up the baby up and give. We have to observe other things also, like weight gain and any urine, how the baby is passing urine. So all those things, and then we can. So no need to keep strict, like to every 2 hours we have to give the baby and give. We can give some time till the baby actively wakes up and shows the signs of hunger.
And protein blood samples, as per the order, we will be connecting the samples through IV cannula or through the needle method, or sometimes USC method. And GRBS will prick the lateral aspects of the heel. If sugars are less than 30 mg per dl, we'll give 10% dextrose 2 ml per kg as bolus, followed by the IV fluid we will give as advised. And if more than 30 mg per dl, we'll initiate the feeds.
I think, sir, you will acknowledge whatever is being mentioned here, like starting the feed and check of the GRBS, and we always tell nurses just to not to pick. No, as you see, the vein is difficult, and all that to be escalated to you all.
Yeah. So usually the prick should be before the feeds to assess the GRBS properly, and we will monitor GRBS at regular interval for few high risk babies only. Not every baby will do the GRBS regular monitoring and all. So any mother who is having diabetes or any child who is less than 2.5 kg weight, and any baby who is on preterm baby or any baby who is on not on feeds, who is on IV fluids, then those babies we usually check the sugars at regular intervals. And the checking the GRBS, that pricking site is also important. It's on the lateral part of the heel. Actually,
Yes.
it should not be in the middle part of the heel. So because the middle part of the heel directly connects the infection that may carry directly to the whole leg. So it may infect the leg. So we have to be proper to the lateral aspect of the heel.
Heel. Yeah.
Care of umbilical cord. Once the cord is clamped, clean and dry, monitor any signs of infection. We should not apply any oil or lubricants. We have to educate the mother. And also regarding the stump fall, it will be fall between 7 to 21 days.
So this has been told to the mother and parents, no, Jyothi?
Yes, ma'am.
Yes. So who administered vaccines? I think, sir, you all administer the vaccine.
Yeah, we are administering, doctors only we are administering
Yes.
the vaccines actually. So the nurses will help for preparing the vaccine and all, but the administration is by doctors only.
Done by you.
But these vaccines can be given with the sisters also. They can give.
Yes,
They
yes.
are
We
experts.
see nurses doing in vaccination room and community health areas, public
Yes,
health
yes.
centers.
They have experience of giving these injections. They can give
Yes.
actually.
I think one should be careful about the route, how
Yeah.
they inject this vaccine, through which route. Yes. So BCG is given in which route, Jyothi? Via which route?
BCG will be given intradermal, ma'am. And
Hepatitis B?
hepatitis B is IM will give.
So deep intramuscular.
Yes.
What could be the site? Site of
Vastus
giving this?
lateralis will give. Vastus
Vastus
lateralis.
lateralis. Yes.
Yes.
Very correct. Yeah. Proceed.
When a newborn is by the mother's side, the baby is positioned close to the mother body or in the cradle, usually on her left side to prevent hypothermia, increases the bonding and the warmth care, safety of newborn and emotional comfort. Neonates thrive on human interaction and physical touch.
So safety of newborns also is very important, sir, because sometimes when we
Yes.
ship the baby to the room side, mother is maybe not aware, or maybe there is nobody to look after the baby. Suddenly mother goes to the toilet, and what could be the safety concerns when the baby shifted to the room side scenarios?
So usually we are keeping the baby inside the baby cradle so that the
Cradle.
raised edges will be there.
Yes.
So baby won't be unsafe areas. So as long as mother is awake and mother is can take care of the baby, we will keep the baby at the mother side only. But if the mother is needing something, mother is sleepy or mother is need to go somewhere, so we will keep the baby in the cradle, and we have to tell them to whenever you are keeping the baby on the side, so you have to take care of the baby. You have to be awake and you have to see the baby actually every time.
Breastfeeding, importance of nutrition. Breastfeeding has to be started as soon as possible. EBM can be given, or if breastfeeding is not sufficient, we have to start with the formula feed as advised by the doctors. Or else we can start with the neolactose. Secondarily, it should be dispatched from the pharmacy in a cold chain box, should be refrigerated in the 2 to 8 degrees in the refrigerator. Not only in the neolactose, we have to store the EBM also. Express breast milk.
So, sir, if breastfeeding is not sufficient, so simultaneously we can also start the formula feeding, I think.
Yes, I mean the first preference is always it should be the breastfeeding.
Breastfeed,
And the thing is to assess the sufficiency is there or not, we have to look for urine output, baby is passing properly urine or not, and how baby is gaining weight or not. So these things are important. So we will advise formula feeding only if the babies have any specific medical conditions or mother is not able to feed the baby, if there is any contraindication for breastfeeding. Like mother is on high dose of any anti-cancer medications or any high-risk medications, all those things. And if the mother had any infections like retroviral or HIV positive mothers, okay. So those things are now after discussing with the parents, we will write the formula. And if the mother having very less breast milk and baby is having hypoglycemia, baby had a risk of hypoglycemia, and all those babies will and babies who are not gaining weight are losing weight, lot of weight in one day. So those kind of babies will advise the formula milk.
So again, for the expressed breast milk, the storage is very important and hygienic and careful handling also should be known to all the nurses. Label and store breast milk properly, because in India this awareness is a little low, but in the Western world, I think this is only the concept. And use sterile breast pump whenever the mother wants to manually express the breast milk. The different types of storages, like few things can be stored for 4 days and all that. We try to just tell to all the viewers. Yes, proceed, Jyothi.
Yeah, one thing is to storing the donor milk or PHPM, partial human breast milk. So whenever you store it in the fridge racks, not in the wall of the, I mean,
Yes,
door
yes.
of the fridge. So that is
Door
what
of the fridge. Yes.
it should not be stored in the door. And we should see the once open, we should not use it more than 24 hours, even if you keep in the fridge also. So that is one more thing.
And it should be thawed properly, and then it should be administered to the baby.
Yes.
Breastfeeding education to the mother. So whenever we are educating the mother, we should always explain regarding the hand hygiene and also the self hygiene before handling the baby. And we should tell the mother importance of breastfeeding versus the formula feedings, and types of breastfeeding positions like cradle hold, side lying position, football method, as we can see here.
Which one is football method? I think this one is football method.
Yeah.
This is the football, not this one holding like a ball, right? Yes.
Yes, ma'am. This one.
So we need to show them the positions. There are no need to tell them the names and all those things.
Yes. It is only in the theory. Yeah,
So this is like comfort of the mother. Whichever position mother is comfort, we can to take care of the baby in that position. And yeah.
And this is a very great point, and I think everybody should know. And sometimes parents have failed to birth the babies, and sometimes they do not know the right technique. And we keep seeing babies coming to the OPD with the colicky and gas pain.
Yeah.
So, what is your few points on this slide?
Yeah, the burping is very important thing to do actually. So most of the times, mothers or attenders who is helping the mothers who is feeding the baby. So they will fail to do proper burping. Actually, they will do for just 1 or 2 minutes, or they won't be keeping the baby in the upright position to allow the gas to pass. But they will do sometimes. They just hold the baby in the horizontal position and they start rocking the baby and see the burping is not coming. And so do put the baby in proper vertical position, and then you can pat the baby with minimal force, or the position itself also is enough for the coming of burping actually. But the thing is, the timing is also important. You have to at least give 15 to 20 minutes or more if the baby is still passing burping and all. And the thing is, if the baby they fail to give burping and babies vomited, the mothers and attendants will be very apprehensive. They will feel like the milk is coming from the mouth and milk is coming from the nose.
Yes.
It will be very scary situation if they see first time and all. So yeah, the burping position is very important. This should be continued for not only in the newborn period, so at least till the first 3 to 4 months. So it should be continued. So immediately after feeding, should keep the baby in the upright position for at least 20 to 30 minutes and all.
And sometimes I think this baby takes a lot of time to, as you said, 20 to 30 minutes. I think this job is given to the fathers. That's what I see. Mothers are teaching them so that mother can rest, and of course, the father also should play, and do this job.
Yeah, he has to bond with the baby also.
Yes.
Both of them should get bond.
And I think one more thing I wanted to know myself, that if the right technique is not formed, I think the burping doesn't come easily, and it takes a lot of time. Right technique and right position is important. Yes.
Yeah, it is not a very complicated thing also. You just put the baby in the upright position. That's it.
Yes.
Either way, you can keep the baby sitting on your thigh, or you can keep the baby on your shoulders.
Shoulder, yes.
Yeah.
So we have come to the end of the discussion, and we would like to hear the conclusion note from your end, and we end the session. So high quality newborn care is essential. I think we were discussing all these points since half an hour. So what is your note to all the NICU nurses?
To summarize, the high quality newborn care includes the care should start from just before the delivery, also not only after the delivery.
Yes.
So we have to that all those temperature and maintenance of bond with the mother and skin to skin contact, and also every step we have to assess the baby properly, and we have to monitor the baby for the with vitals and all, and we have to teach the parents. That is also one important thing, so that they can take care of the baby at their home and all, and we have to give whatever doubts the parents have, we have to rectify them before they leave from the hospital only. Okay, so this involves actually a lot of effort. I mean, good effort from the good neonatologists and good staff nurses, and also the supporting staff, and also the parents part. Okay, and so it is a multidisciplinary approach, we can say, actually. So all these things, when they combine properly, they can give high quality newborn care.
Thank you, sir, for your valuable insight. I hope we will continue to have many more series on this, because half an hour discussion is not enough for the newborn care. I thank you for your very valuable time, and I thank Jyothi, a great effort, and we request all the learners to just follow and implement all these measures, whatever is being spoken. We end the session. Thank you, everyone.
Thank you.